everyone, to another broadcast of Broken But Not Wasted Ministries Thursday Night Live. It is such a wonderful pleasure, privilege to be back in your home after a little rest that we took since December 24th or 25th, I believe. Well, we're back and we are so happy to have you with us. This month of February is dedicated not only to Black History Month, but it is also dedicated to heart health, American Heart Month. So the production team thought it was appropriate to speak about the heart, and this is our first edition on heart health. So Black History Month is not just about focusing on Blacks in America. It is a moment of introspection set aside to understand the basic human empathy and a remembrance of the struggles that were meant for us to be where we are here right now. We just had an election, and we know that Blacks were not able to vote until very recently after the civil rights movement. So we take that to heart. And those struggles have made us more resilient. And if I may say, more understanding and more loving towards one another while giving us a different outlook and approach on life. So we thought it was appropriate because we have so much health disparities amongst our in our community to bring you this broadcast. We have with us tonight Dr. Valerie Reed. She's going to be our presenter, and I'm going to ask you to welcome her to the platform in a minute. Valerie Reed is a nurse practitioner specializing in heart failure care with over 20 years experience at Jackson Memorial Hospital. In 2020, she earned a Doctor of Philosophy in Nursing at Florida International University. Her research study focused on heart failure self-care after leaving the hospital. Study results shows that patients with high family support that receive nurse practitioners telephone calls had fewer hospital readmission and significantly less cost for their care compared to others that did not have nurse practitioner calls. So future plans are combined with her passion for nursing and teaching as she seeks a nursing faculty position at a university here in South Florida or elsewhere. Please help me welcome our guest, special guest, Dr. Valerie Reed, to the platform of Broken But Not Wasted Ministry. Dr. Reed, welcome. It is such a great pleasure, a privilege to have you here on this platform, and thank you for coming on to educate. Like we talked about, Thursday night is about education and forming our community of what's out there. Although we do believe in prayer, prayer is at our core. We are believers, but we also want to be well-rounded so we can have a better life as the Lord gives us. Welcome, Dr. Reed.
Well, thank you so much, and thanks for having me. It's a privilege to be with your guest this evening.
Yes, thank you. So I would like to introduce the audience. Thank you for being here. I would like to ask you, do you know what the Red Dress campaign is about? What is the Red Dress campaign about? Can anybody tell me? Are you here on the live? If you're there, please type what the Red Dress campaign is about. As you may see, me, both myself and my guests, we are wearing red. So what is this about? All right, Dr. Reed, go ahead. You can take it on now.
Okay. Well, welcome everyone. And have you got your answers there for the Red Dress campaign? Is it a chance for us to show some glamour in our lives? for Valentine's?
I don't know. They have not responded. So somebody's getting on right now. So do you know what the red dress campaign is about for the month of February? I know you guys are smart. You guys are intelligent people since we just talked about the heart. So what is the red dress campaign about?
Someone's Googling it.
I don't know. Do you guys know what it's about? The red dress campaign? Come on now. Come on, Vanessa. Heart health. Yeah,
All
we're gonna
right, all right. That's a brilliant start.
Yes, yes.
Brilliant
Very
start.
go ahead, Dr. Reed. You can take it away.
All right. Well, I'm glad to be here this evening, and heart care is my passion, and uh, I couldn't think of a better time to talk about this. So we have a PowerPoint presentation that provides an outline, but I very much want this to be conversational because that's how we learn best when we have exchange going back and forth. So I'm going to share the PowerPoint presentation. Can you see? Okay. So the topic of our discussion is preventing heart disease in Black women. And what we hope to accomplish this evening is to talk about how often do we see heart disease in women and what are the differences for Black women. Look at some of the things that puts us at risks for heart disease, and to look at how we can prevent heart disease from happening. And if there is heart disease, how can we prevent it from getting even worse? So, first question for you. According to the Center for Disease Control, what is the leading cause of death of American women? Is it cancer? Is it lung disease? Diabetes and combined with Alzheimer's disease? Or is it heart disease? Well, if you said heart disease, you're completely right. Heart disease is the #1 killer of women in America. 500,000 women die of heart disease per year. That amounts to 1 woman every minute. So as much as we are afraid of breast cancer and all the different cancers that we hear about, heart disease is really probably going to be the thing that either us or someone in our family will be contending with. So 1 out of, say, 3 women dies from heart disease, which is 6 times more than that for breast cancer. So if you compare men and women, the death rate for women is more than 3 times that for men. And if a man has a heart attack, in the chance of him having another heart attack in a year time is around 18%. I'm sorry. Yes, 18% compared to that of women. So another question for you. Do you think that unless a woman has chest pain, nausea, vomiting, or sweating, she's not having a heart attack? Is that true or is that false? So that's false. The thing is, most women who experience heart attack don't typically get the chest pain and chest pressure that we always hear about. And as a matter of fact, when a woman has a heart attack, up to 1 month before the heart attack happens, they will have a lot of symptoms. And the most common symptom is unusual fatigue. They call it vital exhaustion. That's when you wake up in the morning after a long night of sleep and you still feel tired. Or also sleep disturbance, shortness of breath, indigestion, or what we call heartburn, or feeling anxious. So a lot of time when women have these symptoms, they'll go to their doctors and they complain of these symptoms, and their doctors will say, oh, you're stressed out about your relationships, you're stressed out about work. Women have, even with these symptoms, have even been given antidepressants or antacids, various treatments for these telltale symptoms. So the big take home here is that women experiencing heart attack have different symptoms from men. So we have to be aware of that, aware of these differences. And because these symptoms are so different for men, it sometimes leads to delay in the doctor diagnosing the woman, or maybe the woman might not even seek help for her symptoms, because she might just think that, oh, it's because I'm tired, I just need some more rest. And then also the age of developing heart attacks in women is older than the age in men. And we know about the EKG or ECG, the electrocardiogram. That's often what they use to diagnose, one of the early diagnostic tools that they use to see if a person is having heart attack. Well, the EKG findings, ECG findings in women are usually not saying that they have heart attacks, because when they develop these criteria, the criteria were developed using men. So very often the woman is having a heart attack, but the ECG or EKG won't show that. There's some differences when it comes to we Black people. Whether you say Blacks or African Americans, the death rate from heart disease is 29% higher than in non-Black people, so than in whites or Asians. And more Black women with a lean body mass that die from heart disease. So Black women are disproportionately affected, or we have a worse situation. And one of the problems comes down to heart disease awareness. Sometime back in the late 1990s, the American Heart Association started to recognize that people just weren't aware of their risk for heart disease. So in non-Black women, compared to Black women, we have a very low rate. Only 38% of in their poll, only 38% compared to 62% of non-Black women were aware that of the things that we just talked about, that heart disease happens later in life for most women, that the symptoms are different. And so that affects the frequency of seeking medical care. A lot of it too depends on your income situation, amount of education you have, and where in the country you live. People in rural areas tend to have lesser access to healthcare, people with lower incomes, and people with lower educational attainments. So with all these, as Sarah was saying earlier, it leads to health disparities and unequal care. So we need to look at our risk factors. Number one, it's high blood pressure or hypertension, abbreviated as HTN. Very often in Blacks, we developed hypertension at younger ages. And then they look at obesity in this country as having a body mass index. That's when you compare your weight to your height. We tend to have a higher body mass index than non-Black persons. And so when the body mass index is over 30, that's classified as obese. So there's a 53% of obesity in African Americans, 52% obesity in Mexican Americans, and a lesser amount in white Americans, 34%. We also find that when Black persons have or Black women have diabetes. We have we see leaner women, so women who are not big or not considered obese, to have insulin resistance or develop diabetes in skinnier women than in when you're looking at Black women compared to non-Black women. And we have higher rates of sedentary lifestyle, which means that we're not doing exercise on a regular basis, and we have high levels of bad cholesterol. So the take home from tonight is that we want to raise awareness, and that's what the Red Dress campaign is about. It started with the American Heart Association with their surveys in the late 1990s and going on into the 2000s. And as Sarah was saying, February has been designated as American Heart Month. And the American Heart Association started the Red Dress campaign to raise awareness of all these things that we've just been talking about. The fact that women have different symptoms, women have different risk factors, and we need to be aware of our risks. So anyone who stops you and asks you, why does American Heart Association have a Red Dress campaign? You say to raise awareness for heart health in women. Remember, heart disease is the #1 killer of American women.
So you mean to tell me the wearing the red dress for the month of February, it's not about Valentine's?
It's not about Valentine's. It's to stop the #1 killer.
It's about the heart. About health heart, people. Okay, the red dress, it's about being aware of heart health.
Exactly. Okay. Exactly. So the Aloha campaign is a little acronym that they came up with. A, to assess risk for heart disease and stroke. L, for making lifestyle changes. O, for other interventions, like if you're drug therapies a doctor may provide for you. And the highest priority is to reduce your risk. Avoid hormone therapy, meaning for women who are menopausal, taking estrogen to minimize the menopause symptoms. That's been one of the risks that's shown to worsen your heart health. And then when it comes to vitamins and antioxidants and all the over-the-counter things that especially in our West Indian community, they swear by, none of those have been proven to improve your heart health. So I'm from Jamaica, and every year it seems like there's another in thing that people are trying. At one time it was soursop juice, boiling soursop leaves to make tea. Another time it was moringa and all these things. And maybe they may help, maybe they may not. We don't know. We have no information to say that they help. So if you have been diagnosed with heart disease, the medicines that have been prescribed for you, those are really the best ones to rely on, and the lifestyle changes. So when we talk about primary prevention, we're talking about trying to avoid getting heart disease in the first place. So we look at age, and we talked before, and we said that women typically get heart disease at a higher age, like over 50. We talk about cholesterol, and there are two different types of cholesterol. We want to lower the bad cholesterol. My way, when I talk to patients, of simplifying it, when you talk about the good cholesterol, HDL, I call it the happy cholesterol, H for happy. And the L, that's the bad cholesterol, so I call it the lousy cholesterol. So we want to keep our lousy cholesterol levels low and keep our happy cholesterol levels high. And backing up a little bit of talking about cholesterol, one of the best ways we can do that with our diet is by focusing on plant-based foods. So the more vegetables and fruits you can get in your diet is the better. coming down to blood pressure, we need to keep our blood pressure lower than 130 over 80. Anything going above 130 over 80, we're looking at the high blood pressure range. Keeping your blood sugar within normal ranges. So if you've been diagnosed as having diabetes or pre-diabetes, it's important that you know what your numbers are, and the test that they look at is hemoglobin A1c, or A1c for short. Know what your number is and make sure you work to keep it lower than the dangerous range. And if you smoke, I would just remind you to stop smoking. Do whatever you can. Do whatever you can, because this is a number one driver of heart disease. And the other thing that I should point out too is that all these criteria, we're talking about heart disease, but they also promote development of cancer, having a stroke, and basically inflammation in the body. And smoking is a number one driver of inflammation. So looking at how to prevent heart disease in the first place, like we said, quit smoking. And for those who live with someone who smokes, secondhand smoking is just as dangerous as if you're smoking yourself. So think about the children, think about all the persons in your household. Make it a family activity to work on stopping smoking. And when it comes to activity, you don't have to join a gym. You don't have to be a fitness buff. You don't have to buy the Peloton that they're selling on TV or whatever it's called. All you need to do is at least 30 minutes of brisk walking most days. And when we say brisk walking, I'm not talking about like going to the mall and walking from store to store and stopping here and there. We're talking when you walk fast enough that you can get a little bit of sweat on your eyebrow. And for women who've suffered a heart attack, getting into cardiac rehabilitation has been shown to improve your outcomes after a heart attack. And talking about heart healthy diet, limit salt and high fat foods. And you're gonna find your high fat foods in most of your meat products. So if you can just focus on including a lot of vegetables and a lot of fruits in your diet, you kind of won't have the appetite for or space in your stomach for eating a lot of the other stuff. So that's what I try to focus on for myself. And keeping our weight.
Dr. Reed, you said something that tickled me. You said, so brisk walking is not going to the mall and going from store to store and trying to shop until you drop. That's not what you're talking about, right?
Correct.
That's what I was laughing about.
Yeah, and or I see some people that they're like on their phone and they're texting or whatever, and they're walking, and so your attention can't be on walking because you're texting or you're talking on the phone. So we're talking a brisk walk where you know when you do a brisk walk, you really feel like you're putting up some effort there. Right. And now these, we mentioned earlier the body mass index, and that's a number that compares your height to your weight. I have a little caveat here. I've been fighting with my mother for years with her weight. And when I say, but Mom, you're overweight, she says, whose weight am I over? So we're comparing our weight to our height. We're not comparing our weight to anybody else's. So we know that as Black people, we're more muscular, and we are built differently than non-Black people. So these body mass index that they recommend of 18 to 25, I would stick a pin in there. I mean, don't go by absolute numbers, but the waist circumference, this is a very good tool to use. And you want, when you wrap like a measuring tape around your waist, you want your waist to be less, like around your belly button. You want that measurement to be less than 35 inches. And one of the things that we talk about all the time is the psychological stress. And we all have stress in our lives, and we can't. It's just a fact of life. So what we have to do is think about good ways to manage it. And it turns out that exercise is a very good way to manage stress. Getting omega-3 fatty acids in your diet. Again, you get a lot of your plant-based foods are high in omega-3 fatty acids. Folic acid is a supplement, over-the-counter supplement that is recommended for pregnant women and also to maintain good heart health. But I would say that if you eat a varied diet with a lot of plants and a lot of vegetables, plant-based, you'll be in good shape. So secondary prevention, we're talking about if you've already been diagnosed with heart issues, what are some of the treatments that they provide for you? So number one is we need to keep our blood pressure under control. And whether you have been diagnosed with heart conditions or it's just high blood pressure, please, please, please take your blood pressure medicine because they call high blood pressure the silent killer, or hypertension the silent killer, because most of the times you feel fine. You feel fine even when your blood pressure is sky high. So set a routine for yourself. Sometimes some people have a hard time remembering when to take their blood pressure medicines. Or take medicines altogether. I would say do it. Combine taking your medicines with something that you do every day. Like if you brush your teeth first thing when you wake up in the morning, take your blood pressure pill in the morning. You do it, or if you have to take it twice a day, when you wake up in the morning, when you go to bed at night. So make a routine and a habit out of it. And we want to maintain our blood pressure less than 120/80. Anything over 130/80, we're talking high blood pressure. We talked already about the happy cholesterol, HDL. We want our happy cholesterol level to be higher than 50 and our lousy cholesterol level, the LDL, to be less than 100. And triglycerides is a number that is a factor that comes in the cholesterol panel when the doctor checks your cholesterol panel. And triglycerides sort of tells you how your body is able to deal with fats and sugars. So you want that number to be less than 150. So if a lot of these risk factors we're talking about, even if you haven't been diagnosed with heart disease, but you know you have high blood pressure, you have high blood sugar, diabetes, high body mass index, meaning heavy, you have high stress, even if you haven't been diagnosed with heart disease, you're at high risk for heart disease. So these lifestyle the advice that we're talking about would be good to apply. So very often aspirin is for women who've already suffered a heart attack. Aspirin is included. There are different classes of drugs that are prescribed. One would be what they call beta blocker, and that would be the drugs that end in LOL. So metoprolol, carvedilol, all those drugs are beta blockers. Propranolol. Then another class of drug that's prescribed for women who've had heart attacks, it's ACE inhibitors, and those are the drugs that end in pril, lisinopril, ramipril, all of those. And or they could prescribe angiotensin receptor blocker drug, something like losartan, Diovan, candesartan. And for women who have irregular heartbeats and have what they call atrial fibrillation, they will be prescribed a blood thinner that keeps the blood from clotting. So already here we have like 5 different medicines. So imagine that one day you're fine, next day you have a big event, you go to the hospital and you're prescribed you're prescribed these 5 different types of drugs, don't say, well, oh my goodness, why are they giving me so many drugs? It's different drugs with different categories, all aimed at trying to restore your heart health. We talked a little bit before about hormone replacement therapy. That's something to be avoided because it increases your risk for heart disease or worsen your heart disease. So take home points. Know your risks. So right now, each of us can sit here and say, well, how is my body mass index? How is my cholesterol level? Well, how is my blood pressure? What's my stress level? What's my age? So you should be able to look at your risks even by yourself. And when you're going to see your doctor, it should be consider doctors that are consultants. You're just like how if I wanted to improve my home, I would get an architect or an engineer to give me to tell me, what are the guidelines I have to go by. So that's how it is with a doctor, really. They're consultants. So when you go in, you're should be having an earnest conversation. What are my risks? Let's discuss my risks. Let's see what we can do. And he or she will advise you. And we want to monitor so we can maintain, knowing we're maintaining and achieve our goals and maintain our goal. And most importantly is to keep informed like you are this evening, participate in talks, and especially now that we have such wide access to information on the internet, look things up, verify it with trusted individuals, because we know that not all information we get sometimes are trustworthy, but by all means, keep informed and take care of yourself, because if you don't, nobody else will. So that's the end of the talk. I'll be glad to take any questions you may have.
Thank you so much, Dr. Reed. Yes, we do have a few questions for you. I'm going to put them on the screen.
Oh, great.
Myself have some questions.
Okay.
All right. Besides age being a factor, a risk factor, you talked about hormone therapy. We do have another doctor on the live, and she did at one point mention that hormone therapy is okay. So it seems like even in the scientific world, you get mixed messages. Like some say this is good and others say this is not good. Now, when you talk to an OBGYN, for instance, and women who are getting up in age, menopausal period, menopausal time of their life, they become dry, and OBGYN will recommend hormone therapy. Now, you as a heart doctor, you're saying no hormone therapy. So what do we do as patients?
Very good point.
I know that's a hard question. Yes, I know that's a hard question, but we need to know as patients. I go to my gyno. The gyno says, yes, go ahead and do the hormone therapy. And I go to my cardio. My cardio says no.
It is a dilemma. And as we've been talking with this pandemic, and Dr. Fauci has been saying that we need to give evidence-based advice. So we're going on the recommendations of one of the last studies that was done, looking at hormone replacement therapy in menopausal age women. And the findings of that study showed that women who are starting or stopping hormone replacement therapy in later life, in the menopausal years, there are higher, that the starting the therapy or stopping the therapy places them at higher risk for heart disease. So what I would say is have an earnest conversation with your doctor, your prescriber. As a nurse practitioner, I should stop saying doctor. I should say your prescriber, because a lot of us have a lot of various providers in our that help assist us with our care. So have an honest conversation. I'll be honest with you. I'll use myself as an example. I'm one of the unfortunate women that was going through really, really bad menopause. I had the hot flashes, the weight gain, the anxiety, all of it. And I spoke with my gynecologist, and she says, well, if you're not going to take the hormone replacement therapy that I prescribed for you, stop complaining. So I sit down and I talk about it with my friends and family and everyone else. And it turns out that I don't have any children. So that puts me at high risk for breast cancer, being nulliparous. And then the hormone therapy also puts you at increased risk for breast cancer. There's a history of cancer in my family. All 4 of my grandparents died with cancer. My paternal grandmother died with ovarian cancer. So when I combine all those things, I think, well, that puts me at too high risk with the hormone therapy. So I'm going to try to suffer it out. So that's what I've been doing. And I have my little tissue here. Well, when I get my hot flashes, I dab my face. And if I'm home by myself, I stick my face in the fridge. So, pardon me?
I said we'll talk later about that. I got some tips for you.
Okay. So it's a personal decision. On the other hand, I could have said, you know what, this is just crazy. It's going to ruin my marriage, these hot flashes, the mood swings, and all of this. And I might say, well, I'm going to try it for 6 months, try it for a year, and work it out with my doctor. So it's a personal decision, and all we can do is look at the information that we have available and evaluate our risks. And be aware of our risks. That was an excellent question.
Thank you so much. We have another one.
The average age of women suffering from heart disease, it's older than men, so usually after 50. Not to say that if you're younger than 50, you cannot have heart problems, but on average, it's usually older than 50, in their 60s. If you have no history, what age would the doctor check for heart disease? So I would say this is something this is a conversation we should be having ongoingly, just like how after adolescence, you start being concerned with your gynecological health. I would do the same thing with my heart health. Whenever you should have your blood pressure checked at least once a year, once you're over 18. Have your blood pressure checked at least once a year. Be aware of your body mass index. Once you get into your 40s and 50s, start getting a cholesterol panel checked at least once a year. So again, this requires a conversation with your healthcare provider. Great questions. What are the factors or food that, so the high fat diet, and the high salt diet? Very good question. We have a gentleman here. Welcome.
Yes, that's what I was saying. This is from a man. He's with us answering that question.
Very good. So the high fat diet and high salt diet. So I was listening recently to someone. I don't know if we have any Jamaicans in the audience, but we love the saltfish. That's our national dish, saltfish and ackee and saltfish. And so because it's salted, it's really very salty, and culturally, that's something that we enjoy. But this is wrecking a risk. When you prepare these foods, try to make it as less salty as possible, and maybe just leaving those things for a once in every while treat. Like if you're having a brunch and you're having your girlfriends over and you it's a once a year type thing, and you prepare ackee and saltfish or however you enjoy these salted things. But to like have bacon every day or have ham every day, we know this salt content is high, and those are things that, and the high fat diet, those are the things that contribute to heart disease. And what we eat is so much of habit. So if we practice healthier diets from when we're younger, when we're older, it shouldn't be that hard to change. Someone writes, I love Jamaican dish. You and me both. But those are the things that we have to minimize.
Yes, that's for me too. I love that dish, ackee and codfish. I just love
Oh
it.
yes.
And dumpling. So we have another question.
Okay.
I think you talked about it.
Yes, the aspirin once a day is usually prescribed, even though it's over the counter. It's prescribed once you've had a heart attack. People have talked about taking aspirin once a day just to prevent, and it's not like water. It's not harmless. It can it can increase your risk of having a bleeding event. So this should be something that you talk about with your healthcare provider, and and if unless it's prescribed, I wouldn't just start taking it on my own. That's a good question. Does a glass of wine a day help? Um, or is it just an excuse for drinking? So they talk about the whatever causes the red pigment uh, in the grapes that goes into the red wine. They say that it's good heart health, and I would say if you want to do something for your heart, eat grapes, eat fruits and vegetables. There's nothing wrong with enjoying a glass of wine with your meal, but try not to make it excessive. I hope that explains.
Yes. So this next question, Dr. Reed, we are from the Caribbean. We're from Haiti. And
Mm-hmm.
I'm gonna tag along. I'm gonna write on that question. How
Uh-huh.
do you combine culture and science? Because we Haitian people, we believe in our tea. Okay, there's a SOC, I think that's what they're talking about. She's saying, how do we make Caribbean people take this seriously and not drink Cersei tea for everything? Like the
Oh
Haitian
my
people have
gosh.
tea for everything. So how do you reconcile culture and science? What do you say to your patients when they come in and say, well, I am doing my tea, I'm doing my herbal tea, and this is fine, and so on and so forth? How do you educate them? How do you deal with that to make them understand that science is there for a reason?
Excellent point. And as we were talking about with the hormone replacement therapy, as the healthcare providers, we can only give the advice based on facts, based on the studies and what the studies have shown. So today, we're not aware of any studies that have shown that the bush remedies work. We just don't have it. So that would be like you asking me if what if you shaved all your hair, would that make you live longer? I can't tell you that it would work because we just don't have any evidence on that. Now, as Caribbean people, we believe in our home remedies. And personally, I think that's a good thing. What we have to do, though, is combine the both. So, like, I know people with the COVID pandemic, they've prepared some concoctions with garlic and ginger and turmeric, and they have a big jar in their fridge and they're taking a swig. And I say, do all that and wash your hands and wear your mask and keep 6 feet distance. So combine them. I don't want to take away anything from you that your great-grandmother passed down to you that is believed to help. So use our home remedies, use our bush remedies. Jamaicans, we swear by Cerasy. Cerasy for everything. Bellyache, headache, backache. Here they call it lemongrass. We call it fever grass. That's another one. That's for everything. And there's probably some scientific reasoning behind it because I understand that a lot of these, they're plant-based, first of all, and they're rich in vitamins and antioxidants. So they probably work. We just don't have the science to say how much, when, because the concentration in the leaves is depending on what time of the year that you pick them. How old is the leaf? All these things. We just don't have any evidence to give advice. We just have to say, use what is proven, what has been shown to work, and then you can use along with your home remedies.
Okay. All right. You're not dismissing it.
Pardon me?
No, I was saying you're not dismissing it.
Correct.
Okay. All right. Well, that's exactly what I was going to say. There is an oil, castor oil.
Oh.
That's something else. They say it's good for everything. I mean, everything. Okay. So how do you take that away? Even little children, when they have body aches, they tell their mom, "Mommy, put little masquerade on me." They know. So you can't, you can't really take it away from them, but you just, like you said, you have to educate them and do it and measure. So there is another question. I'm a nurse and I have many male patients who report that they do not want to take their hypertensive medications because of the side effects of sexual dysfunction. Yes. What kind of advice would you have for male patients with high blood pressure?
Very, very good question. So there are so many different classes of high blood pressure medicine or antihypertensive medicines that if someone is having an undesirable side effect with one group of medicine, I would go to my prescriber and have an honest discussion about it. Don't say, "Well, I'm taking it," when you're actually not. Have an honest discussion and say, "This one is creating X problem for me," and then you can work together as you do with any other consultant. And usually you'll find that the erectile dysfunction comes with a lot of the antihypertensives, come with a lot of the beta blockers that we mentioned. So there are other classes of antihypertensive medicines that would be helpful in a case like that. But just don't stop taking your high blood pressure medicine. Yes, someone says their wives are okay with it as long as they're healthy. Yeah, you want to be healthy. Some very good questions we have coming in. And while we're waiting for additional questions, remembering too that worshiping is a really good way to deal with psychological stress. Mm-hmm. Just by feeling connected and feeling that you're not in this alone and that you have support.
Mm-hmm. Yes, absolutely. Mm-hmm. Absolutely. Thank you so much, Dr. Reed, for answering all these questions. I'm not sure if we have more coming, but you've done a wonderful job at presenting this very important topic. This is the first edition of Heart Health for this month, besides celebrating Black History Month. Like we said, that's very important. And we know there is a great disproportion of and the people who are dying, you said 500,000, correct?
Correct.
Dying because of heart disease, and the burden of disease is on the black communities and the ones, the minorities, if you want to put it that way. So it's
Right.
very important that we are made aware, that we are educated, and we know. I'm telling you, I've been wanting to go get back and walking and exercising, and today I went and I bought my veggies again. I just came back,
Excellent.
but I feel like I was not eating right after the fast, so I'm starting to get back on. So I'm picking up. So it's good. We have to do that for ourselves, like you said. If we don't take care of ourselves, who will? But
Exactly.
you said something about women, right? You said about a month prior to having a heart attack, the
Hmm.
women might feel like very fatigued. Even after sleeping a good night's sleep, you're still waking up fatigued. But
Correct.
I thought that was the story of all women. I thought this was a
Exactly.
story of all working family women. I mean, it seems like you always feel a little bit tired because of all the things that you're juggling. So, what's the measuring stick? How do you know when you've gone over that feeling of regular tiredness?
So that's why it's important to know what our risks. If if this tiredness that I'm feeling has been going on for a little while, and I know that I also have high blood pressure, I'm overweight, I have high cholesterol, then worrying about heart disease is high up there on top of my list. So that would make me want to go for help sooner than if I was unaware that tiredness could be a signal of heart disease. So it's being aware of our risks. My doctor put me on a
This is
beta blocker.
this is from my sister. So, yes.
Okay. Okay, so you had a problem with palpitations, and you didn't take the medicine, and with changes in the diet and exercise, you're feeling better. Wonderful, wonderful. Keep monitoring it, and as long as you're not having any problems, then you've basically done well with diet and lifestyle changes.
Yes.
Yes. That's wonderful.
Yes. And I know, oh, I'm echoing. I know firsthand because we lived together for a while, and every morning she would wake up and make her celery and her cucumber, Dr. Reed, for hot flashes. Every
Ah,
morning. Yes, yes, she did. I would hear her on that NutriBullet. She would do the cucumber and the celery every morning, and she would walk,
uh-huh.
and she would say that she feels better. And I mean, it worked. It worked for her.
Thank
Yeah,
God.
her hot flashes stopped and everything. So yeah,
Wonderful.
yes,
Wonderful. And it's plant-based.
it's plant-based. There you go.
Yeah.
My last question, Dr. Reed, is about the antioxidants that you talked about. Just like
Right.
the hormone therapy, you're saying that it's not really proven, it's not evidence-based, that
Correct.
it is good for all that they promote. Can you please elaborate on that a little bit before we end? Thank you.
Sure. So the takeaway is that and all the supplements that there are, they haven't been shown to either prevent or improve heart disease. So it's basically take it if you want. But if you have a diagnosed problem, don't rely on these supplements to fix your problem because there's no evidence to support that they will fix your problems. So, like I take a multivitamin every day just to supplement my diet to balance out my diet, but I can't think that taking a multivitamin every day is going to make me well. I have another question here. Let me put my glasses. So if you're having, so this is a question asking about discomfort in the chest area and how can we know if it's anxiety or it's a pull muscle. And probably the best advice would be to pretend that it's the worst of the two. And then when you find out that it's not a heart-related issue, it's a pulled muscle, then you can deal with that. Because if you're having a heart issue and you delay care, it could be really bad. Whereas if you assume that it's heart problem and you get help for it and it turns out that it's a pulled muscle, then you can feel comforted that it's not the worst.
So you're saying that you have to assume the worst in that case.
Correct.
You have to assume the worst, and if it's not that, then you're fine.
Correct. So if you have high blood pressure and you're prescribed a medicine for it, the goal is that the blood pressure medicine should lower your blood pressure as well as you exercising. By the way, you can lower your blood pressure by 10 points just by walking every day. So if I have like a blood pressure of 140 over 90 and I start a walking program, I can lower that to 130 over 90 just by walking. So if you have high blood pressure and your doctor prescribes you medicine, you should take it and then monitor your blood pressure to make sure that your blood pressure number comes down. That's the goal.
No, I think, doctor, it says if you do not have high blood pressure. If you do not have high blood pressure,
I misread
your
that.
doctor gives you medicine for it, what happens?
Oh, but there should be a conversation. Why is it being prescribed then? Right? Sometimes the antihypertensive medicines can be used for other things. For example, one person earlier talked about palpitations. Now, palpitations is when you feel like your heart is racing away in your chest and just pounding like butterflies in your chest when you're sitting down at rest. High blood pressure medicines can be prescribed to control that. It's not that your blood pressure is high, but they're trying to control the palpitation. So if you're prescribed high blood pressure medicine, I would have a conversation to find out why.
Right, exactly. So if you don't have high blood pressure, maybe something is triggering the blood pressure. Like you do have people who have the white coat syndrome. Whenever they go to the doctor, their pressure is like really, really high. However, they're not suffering from high blood pressure. It's just triggered by being in the doctor's office. Oh my God, what's going to happen to me? I'm sick. And then their their pressure goes high, but they're not suffering from it. So you have to really talk to the doctor and communicate that you do not normally suffer from high blood pressure. That's my nephew there, Sebastian. God bless you.
That's great.
Yes, and unless you have anything to add, Dr. Reed, we're going to put an end to this first edition of Heart Health for the month of February, which is also Black History Month. So happy Black History Month, everybody. Be aware, remember where we came from, how the journey was, what brought us here, and let's stay together. Let's stay united. So Dr. Reed, if you don't have anything to add, we're going to put an end to this wonderful broadcast. Again, we thank you for coming on. Anything else?
Thank you for providing the opportunity. I love being with you.
Yes, thank you so much, Dr. Reed. And everyone, I want to thank you for being here again on this first edition after we've been off the air since December 25th. I thank you for being here. I long to be here, but I wanted to get a little rest. So tomorrow morning, we're going to hop on at 6 o'clock for prayer. I will not be staying long, but I will have important announcements as far as scheduling for the year, what we're going to be doing for the year. So hop on tomorrow morning at 6 o'clock so you can get these announcements. Thank you so very much, everyone. All of you who participated, all of you who came on late. I see some of you coming on very late.
Good evening, Lenia.
Yes, you can go back and watch it. I know you will or you might. Yes. Okay. Gael, she's a nurse in New York. She said it's called white coat hypertension. Yes. Okay.
Correct,
Great
correct.
education session. Thank you, Dr. Reed. The audience thanks you so much. And we
Thank you
say,
so much. Take care. Have a great
yes,
weekend and keep
thank you
safe.
so much. Yes, be
Okay,
safe.
bye bye.
We'll talk. Yes. So this ends our first edition of Heart Health for the month of February. Again, thank you for being here. I'll see you tomorrow morning at 6 o'clock from some announcements for our upcoming year schedule. God bless you. May the Lord keep you and bless you. May the Lord make his face shine upon you. May he give you his peace. May the Lord turn his face toward you and may he give you his grace in Jesus' name. I'll see you tomorrow morning. God bless you. Be safe.